The Nigerian Center for Disease Control and Prevention on Friday said the country has recorded 1,307 suspected cases of cholera across 30 states and 98 local government areas. Good day, viewers. Welcome back to DDM House News Updates on our program, Your Health, Your Wealth. As usual, I often remind you guys to subscribe to our YouTube channel, that is Dashraw Digital Media, to get the latest. Hear what we have today. Award-winning Nigerian author Chimamanda Ngozi Adichie has spoken about her decision to welcome twins via surrogacy, addressing the public reaction and societal pressures surrounding non-traditional paths to motherhood. Speaking during the Withstood live talk hosted by media entrepreneur Jude Jidou, Adichie expressed disappointment over the way her personal decision became politicized online, stating that she chose to be transparent about the surrogacy to counter harmful narratives that could pressure other women. She said, "There are certain things you cannot hide. You cannot hide the existence of two perfect human beings. People just went off with this thing. She's 47. She had babies, and I don't like to lie about things that can be consequential for other people. I felt that there were many women who would then be pressured by people and be told, look, she's 47 and she had twins. What about you?" A viewer said to me that I look so fantastic for someone who just had babies, and I am not going to say, "Oh, thank you," because that's a lie. So I said, well, they were born by a surrogate, and apparently I hear that there was a bit of noise about that. My boys are so precious to me, and I heard that anything about them would become politicized. So, the one hand I wished I hadn't talked, but in another hand, there is no way I'm going to lie and claim that I have babies that I didn't birth myself. Speaking about the stigma surrounding fertility challenges, Adichie said, I think there is so much shame around issues of fertility, and I think it's too much of a burden for women. Yeah, I agree with you. Women are ashamed when they have fibroids. Women are ashamed when they have trouble getting pregnant. And I don't believe in that sort of shame. Okay. She also responded to critics who view surrogacy as dehumanizing and acknowledged that it can be done responsibly. They think that you cannot rent a woman's body. They argue that it's dehumanizing. I think it can be, but I think it matters how it's done, because it can be done ethically. Also, the same people will say that a woman can do whatever she wants with her body, which is true. There is a contradiction there. That was what all the noise was all about, she added. Despite the backlash, Adichie said she had no regrets and emphasized the joy her children have brought her. She said, I am hoping that if anything good comes out of this, it will be that more women will feel less ashamed of talking about reaching motherhood through non-traditional means. Okay. There are other women who have babies by surrogates, but they sort of go and hide for 9 months, or people who adopt babies and they go and hide because of society is so judgmental. And I don't think that is a good for anybody. I think my daughter and my babies are greatest gifts I have given so far. So zero to regret. Well, DDM Online reported in February that Adichie revealed she gave birth to twin boys in 2024, adding to her family, including her 9-year-old daughter, stating that she was always conscious about revealing too much, particularly when it comes to her family. So she has also expressed her commitment to raising her sons with values that promote gender equality and respect for women. Okay. Next, the Nigerian Center for Disease Control and Prevention on Friday said the country has recorded 1,307 suspected cases of cholera across 30 states and 98 local government areas. The Nigerian General of NCDC, Dr. Jide Idris, who stated this at the National Health Security Press Briefing in Abuja, added that the country also recorded 34 cholera-associated deaths, resulting in a case fatality rate of 2.6%, which is above the target of less than 1%. According to him, cholera remains endemic in Nigeria, particularly in communities with limited access to clean water and sanitation, and it is highly contagious infection caused by the bacterium Vibrio cholerae and can be fatal without prompt and adequate treatment. So he warned that as the country approaches the peak of rainy season, a concerning trend in cholera transmission is emerging. Please, oh. The proactive dissemination of localized flood risk data is expected to drive coordinated action at the federal, state, and community levels, ensuring timely interventions that can help prevent waterborne diseases outbreaks like cholera. NCDC is actively tracking this occurrence. As of epidemiological week 16, that is ending 20th April 2025, 1,307 suspected cases of cholera have been reported across 30 states and 98 local government areas, with 34 associated deaths, resulting in a CFR of 2.6%. Oh my goodness. This rate is well above our target of less than 1%, Idris added. My dear, cholera is a food and waterborne disease caused by the injection of the organism Vibrio cholerae in contaminated water and food. So ask yourself, the water I take, how neat is it? Water is usually contaminated by the feces of infected individuals. Yeah, contamination of drinking water can occur at the source during transportation or during storage at home. Food may be contaminated by soiled hands, either during preparation or while eating. That is why we said wash your hand. Beverages prepared with contaminated water and sold by street vendors, ice, and commercially bottled water have been implicated as vehicles of transmission, as have cooked vegetables and fruits freshened with untreated wastewater. The time between infection and the appearance of symptoms, that is the incubation period, is 2 hours and 5 days. So it has a higher risk of transmission in areas that lack adequate sanitation facilities and a regular supply of clean water. So unsafe practices such as improper disposal of refuse and open defecation endanger the safety of water used for drinking and personal use. Idris pointed out that the people most at risk of cholera are people of all ages living in places with limited access of clean water, people living in areas with poor sanitation and poor hygiene, people living in slum areas where basic water or sanitation infrastructure is missing, people living in rural areas who depend on surface water or unsafe pipes or borehole well water sources for drinking, people who consume potentially contaminated fruits or food without washing or cooking properly, and people who do not perform hand hygiene at appropriate time. That is why I often say, please try to wash your hand. It's very essential because it's also source of our infection contamination. So, other risk factors are man-made or natural disaster like flood, resulting in population movement and overcrowded refugee camps, relatives who care for sick people with cholera at home, and healthcare workers including doctors, nurses, laboratory scientists, and other health workers who provide direct patient care in the absence of substantive precaution. This is why we advise the doctors, the nurses, and other health workers, please make sure you put on your gloves before attending to any patients. The symptoms of cholera include acute profuse, painless, watery diarrhea, that is characteristics of rice water stools of sudden onset, with or without vomiting. It may be associated with nausea, profuse vomiting, and fever. Okay. Severe cases can lead to death within hours due to dehydration, that is massive body fluid loss. So, however, most infected people, about 80%, may only show mild symptoms or have no symptoms at all. So please, don't joke with cholera. It's a very dangerous disease. The disease is easily treatable if detected early. So please, check yourself. Most infected people can be treated successfully through prompt administration of oral rehydration solution to replace lost fluids and electrolytes, and also appropriate antibiotics. The ORS solution is a powder that can be reconstituted in boiled or bottled water. Cholera can be deadly when infected people do not access care immediately. Cholera can be preventable through ensuring access of safe, potable drinking water, proper sanitation and waste disposal, and appropriate hygiene, including hand washing. Raw fruits and vegetable food from street vendors and raw or uncooked seafood should be avoided. Please. I also advise the public to reduce the risks of cholera by ensuring that water is boiled and stored in a clean and covered container before drinking. Practicing good personal hand hygiene, using alcohol-based hand sanitizer, ensuring that food is well cooked before consumption, avoiding open defecation, and indiscriminate refuse dumping. Also, I advise the health workers to play a vital role in detecting and managing cholera cases by adhering strictly to the infection prevention and control protocols, reporting suspected cases to the disease surveillance and notification officers, and also educating patients and community members about preventable practices. Also speaking, advice was given to the state government to prioritize action for solutions that ensure access to and use of safe water, basic sanitation and proper hygiene practices in communities. To ensure readiness and early control, the NCDC is implementing cholera readiness workshops in the southwest and northwest to enhance preparedness and response capacity. Similar ones are planned for the south-south, northeast, and north-central zones of the country in May. Treatment protocols disseminated to all states, prepositioned response commodities, that is, cholera test kits, with appropriate training. 134 local government areas classified as hotspots have been prioritized for multi-sectoral intervention, including potential RRT deployment, risk communication materials reviewed and updated, and airing to commence immediately. 36 plus 1 states are currently being assessed for readiness for cholera outbreaks. Ask yourself, are you ready? While new cholera cases remain relatively low, they are spread across 30 states amid the rainy season underscores the need for sustained vigilance. We call for intensifying multi-sectoral collaboration, especially in water, sanitation, and hygiene, to prevent further transmission and reduce mortality rates. So, the agency remains committed to leading a coordinated national response, working closely with state governments and partners to ensure timely support and regular updates. So please, join the chorus. Join the chorus by adhering strictly to the information given to you. Keep your room neat. Make sure the water you take are very, very neat. Please, boil your water before you take it. Wash your hand. Everything you do should be neat to avoid cholera. Please, don't forget to do that. With this, we come to the end of our discussion on your health, your wealth. Please do ensure to like, share, comment, and subscribe to our YouTube channel, Diaspora Digital Media, to get the latest, to get things to do and not to do on your health, because your health is your wealth. Until next time I come your way, I am Nyenyor Michael Inezini. Thanks for watching. Do have a beautiful day ahead. Bye for now.
We've recorded a total number of 2,102 suspected cases, 63 deaths, unfortunately, and across more states now 33 states, and 122 local government areas, with a case fatality rate of 3%, of course, which is slightly less than 3.2% presented the last time. 10 states out of the total states in Nigeria are responsible for about 92% of the cases we have now. We will continue as NDC to advocate to state governments on the need to prioritize action for solutions, ensure access to and use of safe water, basic sanitation, and proper hygiene practices in communities,